Good morning, students. Good morning. You are welcome to our today's class, PAC 201. PAC 201. In our last class, Martha, please. In our last class, we concluded with where did we stop in our last class? I don't say what. You don't know. Yes, I think so. We finished everything there, right? And today we are starting with what? Yes, thank you. VCT and test VCT. Military counseling and what testing. And in one of our lectures, I talked about this, if you can remember. Is that where we stopped?
Yes.
To start from where today? Am I going to do it? Huh? We've done it, Shay? Are you sure we've not done it? Where exactly did you stop there? Okay. Say what? Okay. Okay, we introduced adolescent reproductive health services, right? Then we talked about, I think that our focus is on two aspects, on the drug wars, abuse what education, right? Then and prevention. Then also the what? Adolescent education what? Pregnancy education and what? Prevention. So now we treated I can remember now we stopped at drug abuse and education and what? Prevention. So we talked about how we can different ways we can educate them properly on what? Drug abuse. So as to do what? Prevent what? Drug abuse. Yes, I can remember now. And we stopped at counseling and what? Therapy. So today we go back to what? Adolescents what? Pregnancy, education and what? Prevention. Because when you say adolescent, we have the male counterpart and the what? Female counterpart. They can make a counterpart. Their major issue is always in that aspect of what? Drug what? Abuse. That is where they dwell more. Am I correct? Then why female on the issue of what? Even now, female are also going into what? Drug abuse. True of us? Yes. Female are everywhere, both the drug abuse and the what? Yes. But what happens in pregnancy is what? If the female doesn't accept, or maybe prevented, maybe avoid being convinced or being raped, would have the issue of what? Pregnancy? No. Right? Yes. So the male alone cannot impregnate themselves unless they are hermaphrodites. Unless they are what? Hermaphrodites. Right. So now, let's look at what the pregnancy what? Education. So the first thing I want us to look at is what? To prevent this, there should be a what? Comprehensive what? Sex education. Mary again. You are doing what I don't know. What are you copying? Comprehensive what? Sex what? Education. So there should be programs, not just programs that promote sex education. There should be evidence based. There should be evidence what? Based programs that you should do what? to promote what? Healthy relationship and what? Contraception. Healthy relationship. Take it or leave it. This adolescent stage, there's always that. If you study the education of early and childhood education to the adolescent level, you find out that there's always this tendency not to be alone. Two of us. Two of us. In fact, now we have changed the world of today. We have changed status now. We have changed. Have you noticed that the status has been changed now? Before what we have married, single, then divorce, right? Or separated. But now single is not actually the single it used to be before. Have you noticed that? The social values is changing now. Among our youth, single is not about getting married again. Single is about being about in a relationship. You see a small boy of 10 years, 15 years, you say I'm not single. Huh? Are you married? Have you noticed that? Yes. We call this social change. Yes. It's becoming common now among our young people. If you see someone that's like 15 years, see I'm not single. I'll be like, are you married? You see that he's not single because you're in a relationship, because you have a boyfriend or a girlfriend. You say you're not single. I'll be like, wow. Tomorrow again, you have issues. You break up. Then you go to another person again and continue your entanglement. Am I communicating? Yeah. You see, nobody say that I'm
single and searching.
No, they say that the person you are doing a dating with is not your husband, and you are saying that you are. I don't understand. And that this nonsense is what lead to pepper soup poisoning. It's this nonsense that leads to what? Pepper soup poisoning, because you have been telling people that you are not single. Maybe those that are supposed to marry you will leave you and go their way. This one is not serious. Whereas you are messing yourself out with one useless boy that doesn't have no his direction in life. That don't even know where he will end up. In his mind, he's thinking of where to live his life. And you're wasting your time saying that you are not single. Wasting your time. Tomorrow now, if you now travel to another place and start a new life and meet somebody that will even help you to become more focused in life, you start saying that he dumped you. That he dumped you. So we go and commit suicide that he dumped you. I think we really need to change that mentality. That is dangerous, because anybody 15, 16 doesn't even know anything about life. Two of us. Yes. It's a very big problem. It's a serious bombshell. It's a serious. Yeah. When this nonsense will come, of course, it started. You see how five people gone. You see how 5 promising young men gone, just like that, because of one useless human being that doesn't even know where he should end up. I saw a picture like, is this even up to 20 years? What does she know about life? You just put something there, just waste life there because she's your ex. Probably you'll be saying, I'm not single. You are single until that man comes to your house and meets your people and pay your bride price.
100%
Until then,
100%
until he came with his people and meet your people and pay your bride price, and your people and their people agree, and they agree, they tell you bye bye, you carry and go officially to their house. You are single. They don't like, I'm not single, because you are doing stupid relationship. That's what we are talking about here. Promoting healthy what? Relationship. You are just a sex toy. That is nonsense. That's what you are. Until a man comes to your house and see your people like a man
Like a real man.
and pay a bride price, you are a sex toy. It's a bitter truth. You are just a sex toy. When you want to know whether it's a sex toy, tell the person, come to my place. Wait now, it's not yet time. It's a sign that you are a sex toy. Accept it and be happy. I don't know whether you are the ones you using him as maybe two of you are using yourself as sex toy. Because sure, you use toy to practice. Two of us. You see, this toy you buy for your children, toy car. They use that toy to learn how to drive. When they now grow and have their own car. That's who you are. Two of you are sex toys. Maybe you are a sex toy to the girl, she's a sex toy to you. And you did all this nonsense until she becomes what? Pregnant. And that's why you see, these are the people that come to buy posts on every every week. Yes, now. Yes, it's this category of people. Because they are told with this you not be pregnant. They come every week to buy it. Every sexual encounter they buy it and take. And you the gear, the fool. It's your system that is being messed up. The guy is intact. When you are done, he look at you. You are scattered. You go and marry the person that is there waiting for you. Tomorrow you start saying he broke my heart. You are the fool there. And until you start teaching this, as I said, this young girls all these things, this nonsense will still continue. It will continue. So that's what you're talking about. Programs that will promote what? Healthy. They're not to see. If you promote a healthy relationship, there are a lot to gain from interacting with opposite sex. As you are growing up, you can build lay good foundation for good relationship. That even such people with such sad relationship may even end up getting married sometime in the future. Because if you make it, you only look at for their childhood friends. Someone that understands you, that know where you started from. Your friend, it's always good to marry your friend, unless you don't have any. Maybe you want the opportunity to mix up and have good friends around you. If you marry your friends, your friend, you see how sweet marriage can be. Yes. Your partner should be your friend. Then if you have an opportunity to have such people around you as you are growing up, no problem. You can get married to somebody and make the person your friend. Then you see how sweet marriage can be. Am I competing? So we are talking about what? Promoting healthy what? Relationship and what? Contra what? Section. You look at them, if you don't teach this young our adolescents, if you don't teach them all these things, abortion will be on the what? On the what? And most of them are not even healthy one. Abortion is abortion. But the worst thing that can happen to you is that you go and commit abortion. Both the baby you want to flush out will go, and you yourself will even die. Is that one not the worst? Most of them because of course now your conscience says that this is not the right time. You go and they'll do hide. Become too pregnant, hide. You go to their parents, hide, and go and meet one quack, hide, and they will now give the one to them. They keep hiding until their system will start decaying, hide, and they will die. And they do what? They will die. A lot of our young ladies die every day because of this nonsense. Yes, you are messed up. You have to tell your parents, Mommy, Daddy, I am what? Pregnant. They should kill you. I've seen people that no matter what happens, yes, they meet fuck up. They face that what? Challenge. Am I competing? But most of these things they do end up in complication. Those that survive it will end up having issues. Some their womb will scatter. Yes. Some their womb will what? Scatter. when it's time to give birth, one innocent man that did not even know what nonsense she was doing will bear the pain. Please help me open this place. So the area will start if we have our younger ones. Please you sit them down. This start from bringing them. Out of this question, all of them they have boyfriends, they have girlfriends. Ask them who is your boyfriend. You must ask that question. Don't say it's not true. Some may even be in your house. Maybe they will have up to 10 body count. You won't even know. Yes, you won't even know. You see them as one. You know, and when it will happen, they won't tell you because they have been hiding from you. They will keep hiding until they die or destroy themselves. So these things are very, very, very important. It's only when you interact that you can sit down and educate them on the right way to go about it. Am I communicating? Then another one is what? Abstinence, what? Education. This one now you combine what? Abstinence and what? Contraception, what? Information. Is during the course of this education telling them about good relationship. People can still have a healthy relationship without messing themselves up. It is still possible. It's still what? Possible. But the issue is this: most people are not informed. And they think, in fact, what is going on in fact today, unlike those days, you see a guy, you see a young, maybe secondary school boy and girl, they are together, they are close, but the man don't even go to the extent of having sex. All they care is how to help each other. But these days, it's all about sex. It's all about sex. The fact they see it as their right self. Yes. You see somebody that don't even know your father's compound. You don't even know anything about your family. He's claiming he be acting as if he's his husband. Telling you what to do and what not to do, how to sit and where to go and what. You don't even know how you feel in your family. He can't even help you to even feed himself. He's claiming because he said, "Can we be in a relationship?" You say you accept. That's the end. You start acting like a husband. Some are in school, married in school, and I've heard people know that they are married in school. And these are the people that will go and keep doing abortion. Before she graduates, she has done up to 5 to 6 abortion. Why? Because they are married illegally. They married illegally. They are school husband and what? Wives. And these are nonsense they learn from where? Secondary school. And they carry it, they now enter school and now get married in school. So what am I saying? It is about what? Abstinence. Not this is also among not this is also apart from this. Of course, we are talking about what adolescents. So let me focus on what adolescents. Please tell them. There's this. So some of this trend I see. You see somebody you know that she's not married. All these TikTok. They just write one thing on they will be that this song they normally sing. I'm single, something like that. They just you see someone that you that he in fact that person has not even gotten admission into the university. He will say and he will say that he's single. They will slap her. She'll come back as if she's not single. You are single until they pay your bride price. You don't lie. That slap is not a healthy education. It's not healthy. Are you single? Are you single? Are you single?
I'm married.
He's married. Good. I like that. He's married. If you are married, you are married. If you are single, you are single. If you are in a relationship, you are what? Single. Don't deceive yourself. So you don't end up looking for who to poison.
Oh Jesus.
All right. So now We look at what? Teen friendly. Teen what? Teen friendly what? Reproductive what? Services. So we have what? Accessible, confidential what? Health what? Care. Maybe what there is now. What I said, tell me what I said, tell me what I said. What I said. You see now?
Accessible.
She said accessible what? Mary. This is the content I want you today.
How to meet up.
Get focused. Next time you leave my class. Now, so team friendly what, productive what, health what, services. Of course, this is still boils down to bringing the what close. You start from your home, start from people around you, where you work, people that come to you where you work. You educate them properly. It's very important. It's very very what important. Then of course, peer education and what support groups. Peer education and what support what groups. On a more serious note, see, do you know why education is important? Some of these our adolescents wasting their life like this. If they got the proper education, they wouldn't have entered into such. Are you aware? Are you aware? Yes. They wouldn't have entered into such lifestyle because it was through education that they entered into such lifestyle. But a what? An unhealthy what? One. True of us, people or persons educated them into that. Either by observing what those people are doing. It's also a part of learning. True. Are you aware? By observing see what people are doing, see what their classmates are doing, and they will join them. See what they are. In fact, it's even you will see some. God forbid bad thing. Even if you sample the type of discussion, young girls is always like discussion. You'll be like, what's wrong? What is wrong with this generation? They want to, hey, who's your boyfriend? Do you have a boyfriend? And if you say you don't have a boyfriend, they look at you as if and you are pretending. You are pretending. If how can you not have a boyfriend? And they don't be seen as if he's then you see somebody that don't even know what he wants. Just because they say they have a boyfriend, you start looking for boyfriend. You should not start looking for a boyfriend as if that is what she came to do. And she will feeling pain that she had no boyfriend. Can you imagine that? Just because others have what? Boyfriend. Then when one useless human being come now and say she will accept and they will continue. Of course, she was asking them what they do with their boyfriend. They start telling them what they do. One stupid human being that is wasted in their house. Their parents mess her up. They didn't train her well. We now come and train them on what they do with boyfriend and what girlfriend. Maybe she's watching porn in their house. She'll come and tell them how to do boyfriend and girlfriend, because it's not having boyfriend and girlfriend that matters. What do you do with your boyfriend and your girlfriend? So that you see yourself, you don't know what to say. Because you know why? It didn't flow from friendship. Am I competing? It don't flow from what? Friendship. Just because they say you have a boyfriend, you see them, they want to have one, they don't have one. Good. What do you now be doing with your boyfriend? So you see that your boyfriend, you don't know what to discuss. Then you start looking for how do you do. They not telling you what they do with their boyfriend, and you start doing it with their what? Boyfriend. And sometimes it's actually those people that have what is called bestie. These are their real friends. Because that friendship grew without anything attached. And these are the people that are even more freer with than the one they call their what? Boyfriend. Because the one they call their boyfriend, the only thing they discuss is to knack. That's all. Nothing else to talk about. That's all. But the one that is genuine and pure is that friendship they develop with somebody. Just maybe they go to the same church, they belong to the same group, They're the same. They met in one school, and they were just friends. They will call a fight. Tomorrow again, they play and they go home, nothing attached. See, listen. What I'm telling you is pure. No matter how you twist it. I'm talking about having good relationship. That is what is called good relationship. Not that one you say, let me not have a boyfriend. Bam, you don't have a boyfriend. Okay, ask. I know that this topic will delay question. I ask. Ask, let me hear you.
You know, some people they used to go to church now. We go to church, and guys, we go to church now for girls. Is it right to go to church and for girlfriend and boyfriend?
Okay, thank you. Hello. Going to church to look for boyfriend. That's not what we are there to do. But remember, let me give you instance now. There are situations whereby maybe for those that go to church, you are in the same group. Let's assume you are in the same group. Maybe you could come from the same side. After church, everybody will going home. You go home. You see yourself. See, nothing attached. You just see yourself friends. And maybe after school, you and two of you just because you are going to the same side, you may even take her. So you may not go to the house. The parents may see you. Hey, okay, how are you? Hey, come. They give you food, you eat. If their daughter comes home, where is okay? Need to come out with okay. You say okay, went to social place. Okay. You see that friendship.
Yes.
You grow. But your boyfriend dare not come and there. And because people are, what are you doing with this person? Even your parents will be asked, what are you doing with this person? Because they know the friendship that is genuine, that grew from purity of heart. They know. They were once like that. When they see that one, they ask that question, what are you doing? They don't ask you, what are you doing with okay? But they ask you, what are you doing with that one? Is that one that you call your boyfriend? They start asking that question, what are you doing with that guy? But the case that comes to your place, even say sometimes say he may even go to your place and stay there watch TV or they want to see that okay, because to them in they are freer with him. Have you ever asked yourself that question? But that your boyfriend, you hiding it. You hiding that your boyfriend. Because you know that something is not okay with it. Two of us, if you want to go to your place, say, hey, please don't go. You know that's how my parents behave. They'll start asking me questions. But okay, I will come to your house, they didn't ask you question. And not okay, you have nothing in your mind towards okay. Okay is just your friend. Am I committing? These are the ones they categorize as bestie. And most time, let me tell you, most time, when they come of age and become, know things about life, is that their bestie they end up falling, going back to. Most times, the greater percentage of times. And that's why sometimes you see them, maybe when they now, that base, maybe at a point when they become conscious of themselves, you see that bestie, some may just out of let's say misdirection of what they actually want, get married. But they are still discussing that bestie. Maybe at that point that they have recognized, actually known things about life. You see themselves developing feelings for their bestie, and they start having sexual affair with that bestie. You see one woman be complaining, his bestie, I married my wife, he's having an affair with his bestie. You are the fool. Once you see that a lady you see I'm deviating, but let me talk about it. Once you see a girl has a bestie and you are growing up, if you are wise, don't go there. In fact, support them. If you are wise, don't try it. If you are wise, forget it. Because anything you do with her, is that her bestie, she will tell. What do I do? Yes. Maybe because she has first rushed and got married. They cannot be together again now, but they say they started experiencing what it means that self consciousness of sexuality has entered. When they start being together to talk, gradually they will start doing something. Yes, they will start doing something. Then you start complaining that your wife or cheated on you. You are the fool then. Yes. Don't you, if you are a guy, if you are a woman, a man that says he want to marry you, and you are that always with her, him, nothing, just friends. Or that, madam, that is the person he loves. Without knowing, please, I love you. Without knowing, and that is the period we talk about. Let's continue, please. Now, next one is what? All these things are part of what? Part of what? Part of what? Yes. Giving them the promoting the right relationship. If as a parent, and from childhood, you notice that your son or your daughter, there's one boy that freely comes to your place, two of them are very close, maybe they belong to one group, all you need to do is to direct them well. Direct them what? Well. Just that thing you see will develop to something in the future. That's why who among you watches this Korean movie very, very well. You see them from childhood, two people are playing. Maybe they will separate. When they don't grow up one day. Maybe one may be in another relationship or getting married. When they don't see, you see them coming together. You see that friendship. You see that friendship. That is so strong that you can never imagine. Me, hey, I am everywhere now. You said that I am everywhere. I am everywhere. I watch Korean movie now. That's one of my best movies. So what point am I making? If you notice that thing, it's not a time to tell story. No. It's time to what? Because what they share, you did not start it. What they share, you did not start. You don't even know where it started. So why are you separating them? Try to just advise them, know what they are doing. Just know what they are doing. That's all. Try to just guide them well properly. It's very important. Because if not, when you separate them, finish. They will now start doing the hidden one will now come up. They will start looking for hidden one. And most people that have that friendship, they find it difficult because sometimes most of this nonsense you see start as just normal companionship. Every human being needs companionship. Even some married women that cheat, their first intention may not actually be to cheat. Yes, I'm talking to you men. Okay, man here now. There's only one man that is here. Some people you see cheat may not even be their intention to cheat or to have a extramarital affair. Some of them may be missing that companionship at home. They may get that companionship from their place of work. Except someone that is an original prostitute. We have original prostitute. That one is the difference. Whatever anything you give them at home, they will look for it outside. I'm talking about people that are responsible. It may be that they are lacking that companionship at home. Maybe their husband doesn't have their time, and maybe they've complained. Maybe somebody where she is working is giving her hard time. To her, she feels so free and secure to discuss things with that person. Things you have been discussing with the husband. Gradually, other things will start to what? Setting in. And before she knows what's happening, she's on bed. I am speaking facts. without knowing, okay?
Yes.
So if the same happens to men, maybe you don't give your man that attention at home, that time you are forming work, busy, children up and down. Your children, no one continue. His secretary is giving him time in the office, and he may not actually be to have affair with her. Just there is this companionship, that's someone you can speak to, stay with, spend time with. Secretary is there to do it for him. Don't worry, this body is filled with chemicals, hormones. Don't worry. Hormones will start acting one day and it will rise. Then you start complaining that your secretary, hey, he's taking me around. You complaining. So what point am I making? So next one is what? Parents adolescent communication. I cannot talk, in fact I cannot ever overemphasize on this. Parents adolescents what? I will be talking about this. Parents adolescents what? Communication. Encourage open what? Discussion. Open it. Don't do. Say it. Come here. I'm seeing you the kukere movement. Who is your boyfriend? You may say it jokingly, come here, you know now. Come. Am I not your mommy? Come. What is it? Tell me what is it. Am I competing? Open discussion about reproductive what? Health. Very important. Don't say it's too heavy in the mouth to say. Say it. Do what? Say it. When you shed light, darkness will do what? Disappear. When you shed light, darkness will do what? Disappear. So when you open it up, that is he or she is hiding will go. You have no secrets. In fact, if you are able to be close either to your any of your words or your child or whatever, to listen that. Wait, so do you think they don't have the urge? They have the urge. Urge is there. The urge to do is there. So if you go to listen that, if you can open up to listen that, telling mommy, I feel like I'm having the urge to do something to you have arrived. You have done what? You have arrived. Okay, you think that they don't have urge? The urge is you have go. The urge is there. They have the urge to do that thing you do with their husband. They have the urge. But if you're not there to direct them, some may go into masturbation, some may go into porn, some may go into other ways to do what? Satisfy themselves. That's why you should do what? Open up that what? Communication is very important. Very, very what? Important. Question. Ask. Feel free.
This kind of case now, when you say they open up and say they have problems, like what kind of advice or what kind of thing are you going to say to them?
Okay, good. Make them realize that urge is normal. Wow, you have the urge. That means you are what? Healthy. Your body is in what? Order. You are what? Healthy. It's normal to have the what? The urge. But the point is this: at this point, you cannot do anything about it. Look for things that will calm you what? Down. Don't stay one place and start thinking about it. You start doing other what? Things. Get busy with what? Something. When is the right time to use it? You will use it what? Well. When is the right time? That urge show that you are strong. That my baby is a strong boy. Baby, you are strong.
What if when
Do you know?
he's up to 20 years?
You keep continue like that. Yes, you have no choice. That yes.
Before you get to that age, you would have
See, somebody you have been with, encouraging with time. There's this what theory talks about knowing your ability to do something. Tell us. Among those theories, I told you to learn about. There's one that tells us about we believing in our ability to do something. Uh, which theory? Good. Self what? Efficacy what? Theory. This is what you capitalize on in giving health what? Education. Knowing that that's how you train somebody. You believe in his ability to do what? Conquer that task. Be able to achieve that. So if you do the right education, living on this theory, the person with time start teaching others. Then you also open up the implication of what you want to do. The implication, if you must do it now, the implication, this may happen, this may happen, this may happen. Weigh the two of them and tell me, is it to hold this, is it to be busy with? See, sometimes this urge may come if you actually channel the energy to something else without it to go. It comes and what goes. Are you aware? Yes. It comes and what goes. But when it comes, you sit down and start entertaining it, romancing it, massaging it. It will blossom. It will what? Blossom. Happening to you is a sign that you are what? Ready. Now, yes, accept it. Yes, I feel urgent now, but I need to do something else that will take my mind away from it. So go out, go meet friends, go out, discuss it. Am I communicating? Engage in something that will do what? Dissuade your mind from it. But if you go and lock yourself in one room and say you have the urge, then will say, what was going on? You start masturbating. And when you masturbate finish, you start regretting. Why did I do this now? Are we together? Because you have conscience. Am I communicating? Yes. So that's what we mean by what. So you can open discussion to discuss it. You will still come to after this class. I was giving you few minutes to I waited for you. I didn't see you. So after this class, you talk to us. It seems treasure has scattered theory. Scattered everything. That's good. I like that. That's good. That's how to learn. You be proactive. If you are told to do something, learn it. It's for your own good. There are some things I will have here. I may not come here and start explaining everything because that is a pure and that's of psychology. That's a pure psychology now. That is an applied psychology, applying it in health education. So if I go into that now, I will start going into other things that at the end we will not be able to cover what we are supposed to do cover. That's why I told you to come and talk to us about that. So on your own, why I mentioned is for you to know that these things are in existence. You can go and develop on your own, study them on your own, then see how you can do what develop in that area. I can't come here, I can't start explaining everything again. No. It will distract us from what we are doing. So that's why I give it to you too. You come and talk to us about it. Then if anyone has contribution we can make, don't be afraid. Okay? Good. Now the next one is what? Let's look at what? Integrated services. Integrated services. There are some services that we can now bring together to do achieve this. We look at school-based health centers. School-based health centers. Here you have some that provide reproductive health services and substance abuse counseling. Yes. School can integrate such where you have, because these things start from mainly primary and secondary school. Yes, you can have we have counselors even in schools where they can be counseled on all these things to disabuse their mind from all these things. Together, they are the productive health and the substance abuse. Are we together? We also have community-based programs where there can be a collaboration with local organizations to address adolescents needs. The online resources are there. Thank God the one of today. You can develop yourself in that line. You can even start online this thing on your own. Please talk about research on that particular thing. Please don't talk about things that are not evidence based, because people are listening to you. So you don't do you don't mislead people. Make sure that any information you are giving, let's assume you want to start online this thing, don't assume. You can, whatever you are telling people, make sure that there is a reference to that. It's evidence was based. Am I communicating? Gradually, you see yourself growing and helping people. And helping what? People. So you can have online resources and what? Hotlines where you can call for other things and for information and support. So we have accessible support for adolescents. What? For adolescents. Are we together? Okay. Now the next short topic I want us to look at and testing. Voluntary counseling and testing on HIV/AIDS. VCT on HIV/AIDS. Because when you fail to open up conversation, communication, and direct them well, it doesn't end in getting pregnant. It may lead to even contracting what diseases. True of us, yes. Sexually transmitted what diseases. So we're not going deep into HIV. We just want to talk about what VCT as part of what primary what healthcare. Now, what is VCT? What is VCT? Voluntary what? Counseling and what? The first point is that it should be what? Voluntary, right? It should be what? Voluntary. Then the patient, the client will be counseled properly on things that can promote, things that can, make them contract the infection, or things they can do to avoid what? Contracting the what? Disease. True of us? Good. And if they finally, at the end, got it, if they are tested and they realize that they have this what? This what? Virus. What they will do, what they should not do. Am I communicating? So, in fact, that is the part that your mind is doing. Who has done for that thing? Hey, who has done that before? Hey, even you that not learned thing, you start asking yourself, was there a time I did something? Hey, telling you, don't worry. And do the work out of it. After the test, when they now get the paper covered, and you now sit down and they start talking to you before they now tell you the result. Hey, at that point, you look for you in the land of the dead, you are there. Because even if you are okay, you be like, what if at the end this morning will open this and tell me, and hey, what will happen? What will my husband say? What will my wife say? What will my parents say? What will my that's why they do what you calm you down. That is, it's not it's not the world. All right. So then let's go to VVCT. Now, what is basically we know that it is critical, it is pivotal, it is crucial, very, very important in prevention and what treatment of what HIV. In fact, it starts from there. It starts from where? From there. So VVCT. VVCT is a confidential and voluntary what process. Please mark the keywords. VCT is a confidential and voluntary, voluntary process where individuals receive what? Counseling and for HIV enabling them to do what? Know their HIV status and make informed decisions about their what? Health. A lot of decisions will be made. It could be that maybe when you know that you are negative, it could be that now, but after today, I will never ever do this again. Is that a what? A decision, right? It is. You say after today, I will never ever do life what? Life what? What again? I will quit. So maybe sex workers. Maybe after that you say, I will never ever. So maybe married woman that's dance one cookery dance, and after the test she's free. She can stand up and say, God, since you do this one for me, I will never ever do this again. You may be a man that's under 16. Then after that you say, Father, after today I will never ever do this again. Then it may be that the person is positive. You say, oh, how do I now, which way, where to go from where, from here? Am I communicating? This whole thing, these decisions are taken based on the what? The results of the what? The test. So it will help in to make an informed, we have, a decision may not be informed. Are you aware? Someone can make a decision that is not what? Informed. Do you understand what I mean by the term informed decision? Yes. Informed decision is always good to whatever, before taking a decision, make sure that any decision you're taking is what? Informed. So you be careful, you know exactly, think about what the pros and what of the what decision you want to do what take, so that at the end you will not do what? Regret it. You will not do what? Regret it. So that's what vivacity is all about. Now, what are the objectives of vivacity? What are the objectives of the what? One is to create what? HIV what? Two of us. Yes. If somebody thing, the person is HIV positive through VCT, through post, test counseling, right? And post work. So after doing make a kind to say, even though I got this, I will not allow another person to do what? I have to be careful with my life now, so that I will not give it to what? Another person. If the person takes such decision after knowing the status, will it reduce the transmission? Yes. It will. Two of us, it will reduce the what? The transmission. The person will just grow old with it and do what? Die. That's the other one end. Two of us, it don't move from him or her to what? Another person. Now, even if the person is testing and the person now find out that is negative, the person can also say, from today henceforth, I will face my wife only. I'll only do it. I will not share my body with another woman from today on. Well, is that not an informed decision? Now, of course, people to share will not see. Yes, but they are carrying that are literally meet on the streets every night. They will not see who to sell it to. Two of us, because it's buying, because you use your money and go and buy it. Two of us, they will not see who to sell it, and they will die with it. Has it not reduced the transmission? Two of us do it. Now, next one is to increase what? It increase what? Early diagnosis. To increase what? Early diagnosis what? Treatment. Yes, because through health education, Go to a church now or to a group of people now and tell them about VCT. Some don't even know anything about it before. Maybe from your from educating them about, maybe there may be 100 people there. In the audience maybe up to 100 people. Maybe after talking to them about the importance of what going for tests, maybe 80 or 40 may decide to go for what test. True of us, yes. And they'll ask you, please, where can I go for this? You say, okay, there's a place you can go to hospital. They'll go there, and they must pass through the what. They can not just walk and say, "That's me." They pass through the what visiting. True of us. Now, if you talk to 100 people and 40 made up their mind to go for visiting after the counseling, the testing, and after the testing, they will now make an informed decision of not continue changing their lifestyle. Are they not want it to reduce the transmission rate? Yes. Yes. Because the more you talk to more people, all of them may not go. But at least, even if 50% go, it's something. It's a progress of us. It's a progress. It's what? Reducing. Of us. Good. Then, to promote behavioral change. Of course, most of 90% of the decision, or more than 100% of the decision they will take, the client to take after knowing their status, boil down to behavioral what? Change. True of us? Yes. Boil down to what? Behavioral what? Change. More than 90% of the decisions they will take boils down to behavioral what? Change. Then next one is what? To improve quality of life for people living with what? HIV. If somebody is passed through VVCT and the person is diagnosed, is actually have the what? The virus. It's confirmed that the person has the virus. The person will be among the people we call what? PLHIV. People living with what? HIV. Now, these people have the right education on how to live their lives with the true of us. In fact, let me be sincere with you. If you have the opportunity to go for training for this HIV, whatever, all this FHI 360 and all those bodies, or plan parenthood, all these groups, if you opportunity to go for their training, and if you opportunity to work in maybe in heart to heart clinic where they come to receive their word medicine, you find out that how their life is planned, the way they plan life for these people. If you say they don't have HIV, live your life like that. Diet, the food you eat, they should be eating. If you that have HIV eat like that, you'll be healthy. Because it's a serious healthy living. That's when you see what is called nutrition. Am I communicating? So whatever is also geared towards what? Improving the quality of what? Life. So if they are counseled properly before testing and post counseling, and they get enrolled in this, they get the what? The quality of life will what? Improve. While you see most people, the people that die from this, maybe carelessness. In the world of today, people that die because of what HIV now is one, maybe out of what? Carelessness. Then secondly, some are stubborn. Some are what? Stubborn. And some may be deceived by some religious group. These are people that die now, recently. People that are deceived by religious what? Group. Tell them that you don't need to. All this, God has taken care of your problem. If you don't take, you're going to take drug, that God will see you through, and you don't have to do all this to do, and they will stop their drug, and they start dying. Am I? So these are things. There's one when I was working in the heart clinic. There's one one patient till today. When I left the place, I was told that she was looking for me. When I met her, she was going. In fact, she was just going. In fact, you look as if they gave up on her. I'm sorry, but this is not what should be, because once you are there, you are supposed to. But from attitude, I noticed it seemed look as if I said no. I will not give up on this lady. I was always sometimes with the work I should by 4. Sometimes I will stay there after 6, trying to see what I can do for her. I didn't even know I was just doing that thing. I didn't even know. But when I resigned from the place, I was the staff, they started calling me on phone. They were like, "Hey, if you see her now, that she's okay now, and she came back looking for you, that she's bouncing now." Because I don't know who deceived her. She stopped taking her medications, and she was dying. If you see her, you can't even collect something from her to eat. You can't even. She started developing tuberculosis. You can't even stay close to her. I don't know how I was able to do it. I was just moved to just not just because each time I don't see her, I will just feel that she may die. She will die. She may go home and die. I will always make sure that make sure that she comes to the clinic. Let me see what she's doing and everything. I will take her folder, follow her up. Any doctor she need to see, I was just doing that. At the point I was like, maybe God, it's not maybe God just used me to, because she gave up. At the point she was like, I said she just gave up. At that point she had already given up the life. Me that was doing that, I didn't even know. I was just fighting to do what I know best I could do to help her. I wasn't even seeing that she will recover so soon. As I was not doing it, but I was not pushed to keep doing it. Even though I'm not sure whether she will survive. But do what you humanly possible for her. Let her, whether she end up surviving or not. At least your conscience will be clear that you have done what you should do. So after some time, when I resigned for the place, I was later told that, if you see her now, check what made me. As I called the sister to tell you the essence I went. I called the sister. This sister came. I was like telling her that if you leave your sister, she will die. You need to help her. I was following her up to the end. Sometimes she will come to the hospital and go, because that also has a chapel. She just go there and lie down. She just remain there. She will not go home. Since she was just, if you see someone that are giving up life, someone that are actually giving up, she was just waiting for the day she will die. Each time I speak to her, she only die, dead. So what point am I making? What even led to this story, sir? Okay. Yes, people will so. Okay, what will make them not to good? Thank you. Is some of them her own case? She was deceived by one. She stopped taking her drug. I don't know the type of one group she was going with. I don't know whether they told her that if you are cured, you don't need all those things. She stopped her medication. And one thing with this is that it doesn't wait till tomorrow. Once you stop taking medication, you see it immediately going down. You see, you don't need anything. Immediately, you see yourself going down. You see yourself degenerating. Immediately, you don't wait till tomorrow. Am I completing? Now, lack of money. No, do it. No. Go back, bro. No. Whoever has to. Even said, unless we have some OIs. We have some OIs. We have OIs. We have we have opportunistic infections that may come in. Of course, you know what causes is. It's just that the virus targets our immune system. So when the immune system is down, any disease that comes around the person will catch it. Yeah, now even these bodies try their best to even get some drugs for other fungal infections. They try their best. No, seriously, they try their best to even get fungal infection drugs. It's we here that says that even spoiling the program by ourselves, because sometimes we don't give proper reports, because what they will send depend on your report for the month. Sometimes due to our nonchalant attitude, we cook up nonsense report and send. They will send what you, so may not, if you don't give the real figure of what you have, of course they hold you responsible. You must give them figure of what you actually happen before they can send in more one. They cannot be sending without reports. So that's how they operate. So if you have bunch of useless human beings that are not serious with their work, and they will not give proper reports of how what they sent was used, and they end up cooking nonsense and saying to them this, so that they will not even send anything because you will not give them any serious reports. Am I communicating? So what they say depend. Or if you have people that are dedicated, knowing that it's life they are saving and are doing the right thing, getting the proper report record of whatever they do and send to them, they will keep sending. They even try to send some area. Some go to instead of send some proteins. Yes. Some go to instead of sending other things that are not even antiretroviral, depending on the report you give to them. Now, if it is a place that so if the place if the community or the center knows what they are doing, these people, this group, these bodies will keep sending, not just only anti for other infection. Some send anti-malaria, some people send antifungal, some say a lot of things. Septrin, send them down. Antibiotic. If as I said, even nutrition, even drugs for not just even drug for tuberculosis, they send them down so as to help these people. So money is actually the main thing, because sometimes so yeah, what so these things are important. So the last one I mentioned is to improve quality of. What did this lecture supposed to end? What's time now? Just the time. So to improve what time. You see now, the brain is firing. Quality of what? The component of what? Visit. What are the component of what? Visit. I think I've mentioned them before now. One is pretest for counseling. Pretest, that time you come, they will start preaching to you, telling you certain things, calming you down, nothing. This test is not a judgment for you. It's not a life whatever for you. Just for us to know, to help you, all those things. is pre-what? To prepare your mind for the test. So here, information is given to you. They start telling you what HIV is. To give you information on what HIV, testing and what implication. So after that now, they will now send it to where you do the what? The test. HIV tests. Here, it can be rapid one, it can be laboratory based what? Testing. You know the one, that is rapid. The one they just do and test. That's one you do properly, you take your blood and do the each of them, either of them, they depend on the one that are doing there, they do the test like that. Now after that, now when the test result is out, you'll be there waiting for them. When it's out, they will not call you. That is the second pre when the second preaching will start. Your heartbeat will increase. Then they will now start telling you everything about life. They will turn to motivators. They will turn to preachers. They will turn to anything to you. They will tell you that in this life you see, this life is not the end of the world. This is just, even if you have it, it's not the end. You live your life normal. You prepare your mind to receive the what? The results. So here now, after the post-testing, interpretation of results, support and referral, depending on what the results shows. If the result shows positive, they will congratulate you and now tell you what and what to do and now follow up. If it is negative, what do I say? If it is negative, don't mind me. You know, 6 months I have been standing there. It's firing already. So I think we'll stop here for today. Before I talk nonsense here. There's no way they will congratulate if you are positive. So if you are negative, they will congratulate at the same time, tell you what and what, so that you should be careful, guard yourself, Then for those that are what positive, they will encourage you, make you realize that it's not the end of the world. They now stress that thing they were telling before. Now openly, very well now. They now come out fully and tell you plainly now that this is not the end of the world. What I want to go. They will now refer, tell you where to go, who to meet, how to go about it. Then if they start talking about disclosure, whether you are willing to disclose, it's you that will know whether you want to disclose. Some other points, some other points, some may not even want to accept that they are positive at that point in time. And that is that part is to accept it is that is the very, I told you about something here. Those that were here in lecture before this lecture started, I told you about accepting your situation. It has psychological connotations. Accepting your situation is because people don't accept where they are, that make them to want to acquire what they're not supposed to acquire at that point in time. They want to start committing one evil or the other to get to where they're not supposed to be at that point in time, because you're not accepted where you are. Am I communicating? Yes. Now, I use your screen as example. Not dressing properly has a lot because you mean that you're not accepted this place. The same thing. Someone that tested positive, that have not accepted it, forget it. If you like, get the best medicine, get the best antiviral, the person will die. Are you aware? Someone that is tested positive and has not come to term to the fact that I am positive, I have accepted it. I have accepted it. I must accept it to know what the next step. Once the person refuses to accept, the person will die, because the person won't even come for any other thing again. The person will disappear. Some of them will disappear, boom, and go and start living their normal life. Yes, some will disappear and go and start living their normal life until they start working like this. Until they look like that's when they will now come back. That way they will not do what? Come back. But that they would have sold to or dash to many people. So some sell, some dash to many people. Then you see them they start coming back to that same hostel again, where they ran away from. You start managing. If they survive, thank God, thank you to God. If they don't survive, RIP. So acceptance is vital. Acceptance is what? Vital. So that's the importance of this what? Counseling. So that the person will accept it. It's when the person will accept it, that's when the person will do what you want him to do. You go to where you want him to go. You go for the test you want to, or any other thing you want to. That's when, if you give the person the medicines, the person will do what? Adhere and take it. Then some when they leave that place, they go to prayer center and start praying. They will pray until they become like a skeleton. Then they will not come back. Out together. Then some will keep saying it's not my portion. Like this, it's not my portion, and continue it's not my portion until they start macheting. Then that's when they do not that it's now my portion. Oh. Then some may survive, some may not what? Survive. So acceptance is pivotal, very, very important. And that your target at that point in time is to help the person to accept the situation. Then look for the next step to take. Are we together? Yes. So these are the benefits of what? And these are what you see under follow-up. So in follow-up, you can link up to what? Treatment, prevention, and support what? Services. And support what? Services. Are we together? Yes, sir. So these are what? The component of what? VCT. In our next class, we continue with what? Benefits of what? VCT. Benefits of what? VCT. So I will stop this class for now, so that I'll give 5 minutes for you to talk to us. Then after that, we write our quiz. Yes, now quiz. Yes, now is it more now? Quiz everyone do. Hello. Our quiz is every Monday, and nothing can change it. If you don't want to write, no problem. What is it? How's that my business? Oh, the quiz must hold. Lie, it must hold. Alright, thank you very much. Any question? Ask. No question. Thank you very much for your attention. God bless you.